Is this what Kim Kardashian has? If she had a BBL, it wouldn't show up on an x-ray, but no one knows that, so now you know. Welcome back, guys. Dr. Ricky with another episode. Today I'm going to do a Q&A episode from 2 TikToks that I've posted in the past that had some really good comments. Here we go. Something that we use very commonly with breast reduction surgery as well as breast lift surgery is called a cookie cutter or the areola marker. We call it the cookie cutter. You're going to see in a second because it looks like a little circle. Oftentimes women have large areola or stretched out areola and they want them to be made smaller. And this is how we do it. So let's check out this video. Cool Surgery Tools Part 4. This is the areola marker, aka the cookie cutter. This is used during breast reduction and breast lift surgery. Oftentimes the areola pigmented portion is way too large and we can use this to reduce it to a much smaller and aesthetically pleasing size. Nice. I forgot that I made that video. That was well done, sir. I'm going to dive in here and pull up some of the common questions that we got based around this video, and let's learn something today. Do y'all have different sizes? Because I do need a lift, but I love how big my areola sizes are. Yes, they do come in different sizes. They typically come in 45, 42, and 38 millimeters. But hey, if patients know that they want a specific size, I can just use my tape measure in surgery, and we have a sterile one that's on the field, and we can measure it to whatever you're trying to look like. So if you really want them to stay slightly larger, but you just want a nice clean circle, we can do that. If you're wanting to reduce them, we can do that too. But like, what if I want mine the size of quarters? Has that ever been actually a request? I don't know if I've ever had them requested to be the size of a quarter. I usually don't get people coming and asking me, specific currencies for their nipple areolar complexes. Does this damage the nerve sensation in the nipple? Excellent question. Wanting a lift, but I'm afraid that my nipple will be sitting on ice. Albeit rare for someone to completely lose sensation in the nipple, it can happen. It is the risk of surgery. The nerves that supply the nipple areolar complex, there's a few main ones, but the main one, we don't see that when we're doing a breast lift. So when we're taking the breast apart and putting it back together, we kind of know where it travels and we know where it lives and we try to stay away from there, but it's not a nerve that we can see. It is very common in the beginning to have sensory changes because of swelling around the nerve. So I will have some women that have decreased sensation that comes back over several months, and have some women who have hypersensation where it feels like electrical shocks, and that's never fun. But on both ends of the spectrum there, I generally see things normalize as the nerves don't have stretch on them anymore, and as the swelling and the tightness around the nerve goes away. It is very possible that you could have permanent change in one direction or the other. And most of the time, there's nothing that we can do about that. It's just one of the risks of surgery. So the next video that I want to get into that I posted recently was about lipedema versus lymphedema. So the video is going to show you lipedema. So we're going to talk today a little bit about what's the difference between lipedema with a P and lymphedema. Now, oftentimes lipedema can cause lymphedema. So we'll get into that when we answer some of the questions, but let's take a look at the video.
I have 12 weeks until surgery, and I had a lot of people asking what the surgery is for. So I have a condition called lipedema where the fat in my thighs just continues to grow, and same within my arms. Now this kind of fat you can't lose through exercise or diet, so you have to get it surgically removed. The procedure I'm getting is water-assisted liposuction. It's a more gentle approach, and we are looking at removing about 5 to 7 liters from my thigh.
She is absolutely right. Lipedema is not like traditional fat. It is commonly seen in women, is genetic, can be very painful. You cannot lose it with a calorie deficit. It does have to be liposuctioned away. Good luck, my friend. All right, great video. So what is lipedema? Lipedema is typically seen mostly in women. It can occur in the arms, but it's usually the lower body, so the gluteal area, the thighs. It's usually from the hips all the way down to the ankles. It spares the feet, and it generally spares the hand. Lipedema can compress the lymphatic vessels because of just sheer volume, where they get increased volume from the lipedema, which are fat. It's abnormal fat collections. And they can compress the vessels, the lymphedema, or the lymphatic vessels, causing lymphedema. So one can go with the other, but lipedema pathologically is very different than lymphedema, because lymphedema can happen anywhere. And so we're going to talk about what are the treatments for that and how do you get diagnosed. So let's look at some of the questions. Can you talk about the signs to look for to identify this from regular fat? Typically, it does need to be diagnosed by a physician because we look for things like uniformity in the extremity. We're able to actually examine whether you have lymphedema or not. Lipedema can be extremely uncomfortable and painful. Lymphedema can cause pain, but typically it does not. The second tip off is that commonly it's non-responsive to things like weight loss. It will not traditionally respond to that. So there's a few things like that we look at when we're taking your history to know, but ultimately you need to see your doctor so they can ask you some of the important questions to try to discern the two as well as do a physical examination. How does this differ from lymphedema? I see them grouped together frequently. Lipedema, the space-occupying lesions can become so large that they compress the lymphatic vessels and they lead to lymphedema. So I think that's where some of the confusion is caused because some people who have lipedema also have lymphedema, but the difference in the diagnosis, as I described before, is just the shape of the leg, the uniformity, the sparing of the feet and the hands, the non-reactiveness to exercise, and generally the tenderness and the pain. So that's how we know. Is this what Kim Kardashian has? I don't know if you guys remember the Kardashian episode where she gets an x-ray of her butt to prove that she doesn't have butt implants. Well, that was awesome because you take the x-ray and you don't see anything. You know why? Fat cells are translucent on radiography. So she pulled one over on you guys. You would see the gluteal implant if she had one, but if she had something like a BBL and had fat transfer to her butt, you wouldn't be able to see that on x-ray because it looks like any other fat cell. All right, that was the last question. So I do want to talk really quickly about treatment, all right? Unfortunately, the most common treatment for this is some type of liposuction. There's something called wet jet liposuction, which I've never even heard of that machine before. I don't have a wet jet machine. Supposedly the wet jet liposuction machine sprays the fat in such a way that it's less traumatic and doesn't injure the lymphatics and things like that. Well, I'm here to tell you that most of us use ultrasound liposuction. I have a Vaser ultrasound machine, and so we use tumescent solution, which is what we use in every type of liposuction where we wet the fat cells, we inject a wetting solution. We use 1 bag of lactated ringers, which is a bag of normal saline. We typically put a little bit of adrenaline or epinephrine in there to constrict blood vessels to prevent bleeding. And when they put lidocaine in there too, plain lidocaine to help with the discomfort, we inject that with a very small cannula and to wet the tissue. And what I like about ultrasound is traditional liposuction, think of your fat cells as grapes on a vine. And so traditional liposuction kind of rips the grapes off the vine, and the vine would be your collagen matrix in which the lymphatics run through there. You've got blood vessels running through there. What I love about ultrasound lipo, like the Vaser machine, is it shakes the grapes off the vines. That actually preserves the lymphatics much better. It preserves the vasculature, so I see very little to no bruising when I use Vaser. As I said before, you might need multiple sessions to get rid of your lymphedema in order to debulk it. I'm having tongue twister day today, like lymphedema and lipedema. I can't say it for some reason. If I were you guys, I would go see a specialist. I've only done a handful of these. It's not that it's that tricky, but I always feel like if you're going to have something that specialized taken care of, you want to make sure you go to someone who does a lot of it. So those are great questions, guys. Both of those were awesome videos with good questions. I hope you guys learned something today. Until next time, Dr. Ricky out.